Assalamu alaikum. I'm Dr. Anup Abdulla. I'm the specialist from the Department of Internal Medicine, KIMS Medical Center, Muharrak. Well, I'm here to talk on diabetes. Many of you may be knowing that November is the Diabetes Awareness Month. When you say about diabetes, the main two things that comes into your mind is hyperglycemia and hypoglycemia. So, hyperglycemia is the elevation of the blood sugar level above 100 and 250 milligram per deciliter, and hypoglycemia is the decrease in the blood sugar level, let's say that less than 70 milligram per deciliter. So many of you may be aware of this equipment here. It's called the glucometer, which many of you may be having at home, or when you of you may coming to the hospital have seen it and have used it. So it's always good to monitor our blood glucose levels at the home at least once in a while, because diabetes is of two types. It is called the type 1 diabetes mellitus and the type 2 diabetes mellitus. The type 1 diabetes mellitus, it happens in 10% of the population, and it mostly occurs in age less than 40 years, and also is most common found in children. It is where insulin is not at all produced in the body. It is the immune destruction of the cells in the pancreas. And type 2 diabetes, where there is decreased insulin production in the body, and this leads to increased glucose concentration in the blood. And both type 1 and type 2 usually produces the most common type of symptoms like increased thirst, there will be itching in your genital areas, you will be having blurred vision, you will be having tiredness, delayed skin wound healing, and all those things. But the most difference among type 1 and type 2 diabetes mellitus is type 1 the symptoms will come very fast, but in type 2 the symptoms won't come very fast. It can go on up to this, you can live symptom free up to a span of 10 years. So you won't be knowing it unless you give a routine checkup either at your home using this machine, or at a medical center or in a hospital setup. So most of this leads because of our lifestyle right now, for present lifestyle, because all of us will be having quick setting carbohydrate diet, no exercise, resort to junk foods. All these leads to diabetes mellitus. So we can control diabetes up to a limit if we reduce the amount of starchy or sugary foods, reduce the amount of junk foods, daily at least do 5 times a week of 30 minutes of exercise, and your routine monitoring. Diabetes as itself is a disease that can be controlled very easily if you follow these steps. But if you don't follow these steps, it can lead to many complications, starting right from the eyes, retinopathy, to your stomach, autonomic dysfunction, to the kidney, nephropathy, to all the nerves in your body, neuropathy, and many things else. It has both micro and big macro complications. So as we all know, please, if you are aware, if you have any of these symptoms, please refer to a nearby doctor or a hospital and get yourself monitored and have a healthy living. That's all. Thank you.